We'll be starting the webinar in another minute. Please bear with us till that time. Welcome to the next in the series of Spine Wellness and Care Foundation webinars. This webinar, like the last few webinars, is being organized in collaboration with the Spinal Foundation. You're aware that we had a webinar last month on a similar issue. However, we are very sad to inform you about the demise of our beloved Major HPS Ahluwalia, Chairman, Indian Spinal Injury Center. He has been a legend. Though his legacy will continue, he has left a large vacuum. His contribution in the field of spinal cord injury management and setting up services in this regard, and also for support for persons with disabilities, is unparalleled. We lost him last Friday, but as a tribute to this great person and for the cause for which he devoted his life, we thought we should not postpone the webinar today. So we'll start this webinar with a 1-minute silence in his memory. We had this webinar, Caregiving, Respect, Resilience and Realism, on 17 December last month. We discussed in the webinar that what makes spinal cord injuries as devastating as they are is that everything about them plays out in absolutes. They are instantaneous, utterly disabling, and horribly permanent. However, there have been a lot of advancements in management of spinal cord injuries ever since it was revolutionized during the Second World War. And today we may say that life after a spinal cord injury can be happy, meaningful, and worth living. But there's a lot of contribution of caregiving and caregivers in achieving this goal in the life of a spinal cord injury. And we know that caregiving has no second agendas or hidden motives. The care is given from love for the joy of giving without expectation, no strings attached. However, caregiving is quite possibly the hardest job in the world. Numerous negative consequences are there for the family caregivers, including stress, isolation, and lost socioeconomic opportunities. The lack of emotional support for family members can result in depression, psychological distress, and withdrawal. Caregivers, no matter what the personality, need support and respite from care to be successful in their efforts. And this support is also very essential so that the caregivers focus on the positive aspects of caregiving, like feelings of self-worth, satisfaction in helping someone they love, fostering closer family relationships, and providing opportunities to reevaluate what feels important and meaningful in life. And hence we thought about this follow-up webinar, Caregiving, Rising Up to the Challenge, so that we could discuss how to support the caregivers so that they can make their task easy and also for the benefit of persons with spinal cord injuries. And we are privileged to have a very distinguished panel today for the webinar. Let me introduce my colleague, Susn Charlifue, PhD and Director of Research Portfolio at Craig Neuro Rehabilitation and Research Hospital. She has 45 years of experience in SCI research and quality assurance, research methodologies, and qualitative methods. She completed her doctorate in health and behavioral science at the University of Colorado, Denver in 2004. She is current co-project director of the Rocky Mountain Regional Spinal Injury System. She is the secretary of the International Spinal Cord Society and hence on the executive and chair of the program committee. She is the treasurer of Asia and will become president-elect in July this year. She has authored or co-authored over 120 manuscripts and book chapters. We are also privileged to have Dr. Jane Duff, consultant clinical psychologist. She's worked in spinal cord injury rehabilitation for over 25 years, providing direct clinical therapy, research, teaching, training, and consultancy. She's the head of the National Spinal Injury Center Clinical Psychology Department at the Stoke Mandeville Hospital since 2017. She leads the UK and Ireland Spinal Injury Psychologist Advisory Group and represents this group on the NHS England Spinal Services Clinical Reference Group. She is the chair of the European Spinal Psychologists Association, ISCOS Psychosocial Special Interest Group. She is also the expert panel member of SCI Development Group of the WHO Rehabilitation 2030 Package of Rehabilitation Interventions and ISCOS Psychosocial Data Set Group. Her main clinical research and publication themes include coping and adjustment, quality of life, rehabilitation, and goal planning, and promoting the development of lifelong self-management skills. She has a dual qualification as a health coach and works alongside the Backup Trust, Spinal Injuries Association, and Aspire in the UK to promote personalized care. We are also joined by Dr. Shanu Srivastava. She is a psychologist trained in cognitive behavioral therapy from Philadelphia, USA. She has experience of over 13 years in this field. She is a senior psychologist at Indian Spinal Injury Center. She's involved in various national and international conferences. She's the chairperson and founder trustee Support Foundation, a registered charitable trust working for persons with special needs and their families in slum and rural areas. We are also privileged to have Mr. Luke Dolan, who's an outreach and support coordinator at the Backup Trust, UK National SCI charity. This trust has also a very interesting history. I would advise you to go into their website and read about their activities and especially how they were set up after their founder got injured in a skiing accident and started skiing for persons with spinal cord injuries, and subsequently this trust is doing much more, helping the caregivers also and those with spinal cord injured. We are also privileged to have with us Ms. Bhavana Issar. She's 25. She was 25-year-old when she lost her father to a degenerative terminal illness, but she saw her mother's journey in caregiving and decided to set up Caregivers Saathi, of which she is the founder. She is the active caregiver and a caregiver Saathi for more than 30 years to loved ones with terminal illness, dementia, and mental illnesses. She is an XLRI Jamshedpur product and has 25 plus years of experience as HR leader, coach, and organization consultant in diverse global companies. She is a process facilitator, Jalstat OD practitioner. She is a fellow Sumedha's Academy for Human Context, member international networks of behavioral sciences, guest faculty at various prestigious organizations like Indian Institute of Management, Ahmedabad, Tata Institute of Social Sciences, Mumbai, and School of Planning and Architecture. She is a motorcyclist and is a Limca record holder in this regard. She is navigating uncharted terrain is not just an adventure, but her purpose. We are also joined by Miss Rima Pande. Her father unfortunately suffered a stroke, and she saw her mother's journey as a caregiver and also was a secondary caregiver. She's an MBA from IIM Kolkata, a healthcare strategy consultant. She lives in Boston. She's mother of 3 kids. The youngest is 10 years old. She enjoys unstructured cooking and also travel. She's passionate about health, nutrition, and poverty alleviation. She has written a book, His Voice. In this fictionalized narrative, Rima Pande immerses herself in her father's consciousness to become his voice, bringing to you the story of her parents, her father's illness, and her powerful giving mother. This book is a very interesting read, especially for healthcare providers and all those involved in caregiving, and would strongly recommend that. And last but not the least is Mr. Swami Nathan Venkatraman, a chemical engineering graduate from Coimbatore Institute of Technology. Swami Nathan has been part of the petroleum refining industry for the past 15 years, performing various roles. Currently employed as a key account manager at Halder Topsoe, a company involved in catalysis and carbon emission reduction technologies, a district level volleyball player, and a sports enthusiast. Swami Nathan is an avid quizzer, loves reading and to go on road trips. He is also an active blood donor. He has been the primary caregiver for his wife, Sugirtha, for the past 2 years, and they are blessed with a son. I want to inform you that with the help of the Spinal Foundation and their peer trainers, we'll have simultaneous Hindi translation in chat box for those who may not be very well versed with English. And this will be by volunteers. Madhuri Paturi from Bangalore, she's an entrepreneur. Shubham Vare from Pune, he is a BA student from Pune University. Parvati Kari from Assam is not well today. She's practicing nurse, but will be joining in the subsequent endeavors for simultaneous Hindi translation. Quality of life of caregivers of people with spinal cord injury is generally lower than that reported for the general population. Health professionals and particularly mental health professionals need to develop more innovative programs for spinal cord injured caregivers. These could include managing family burden, making decisions on caring, and research on family interventional strategies. So hence we'll come to the first question for the panel. How can healthcare professionals help overcome challenges faced by caregivers of persons with spinal injury? Can it be as per any set protocol? And may I first invite my colleague, Dr. Susn Charlifue, to respond to this question. Susie, please unmute yourself.
Okay, I'm so sorry about that. How can healthcare professionals help? Well, training during rehabilitation is very important. We can provide the most resources as possible to teach our family caregivers how to assist their loved ones with spinal cord injury, maneuver through their everyday lives, assisting with activities of daily living, dressing, grooming, bathing, feeding, whatever is necessary based on the level of injury. And we can teach a lot of problem-solving skills during rehabilitation and also help people achieve some ideas about how they can set goals. However, once people return home, the reality is very different from what they will have experienced in the hospital. We can do as much training as possible in the hospital setting, which is quite different from what they will actually experience. They may not have the same level of accessibility within their homes. They may not have the same resources and tools within their homes that they have in the hospital. So we have to keep in touch with people once they return to the home as much as possible and within the limits of our hospital staff, of course, but to find out if people are facing any specific problems. Perhaps a follow-up at 1 month, 3 months, 6 months post-discharge and back to home to find out what's going on, what are the needs, what problems are being faced. Because the issues that people will find that they're addressing when they're in the home setting are going to last for many, many, many years, and they will evolve over time. Loved ones might become a bit more independent, or as they age, become more dependent. And so the caregiving needs will change for those individuals. And the caregivers will also be aging, and they will have increasing needs and possibly a decreasing ability to provide the assistance that they need to. So it's important that we, address things as quickly as possible and maintain contact throughout people's lives to make sure we can address those needs. And I think Jane, as a clinician, will have many more ideas on what clinicians can do actively.
Dr. Jane Duff, could we have your response to this question?
Hello, thank you very much. Susie, that was a great summary. Yeah, I agree, much happens in hospitals, but sometimes the focus is still predominantly physical in rehabilitation. And I think to enable that community integration that Susie talked about, we really need to have full integration of caregivers in the hospital setting itself, which sometimes is difficult to attain, particularly in terms of people traveling a long distance and other care responsibilities. But as much as possible, particularly in goal planning, particularly in involving caregivers in knowing what spinal cord rehabilitation is about. Something we do in the UK is have a family and friends day, which we provide people with information regarding that. And I think that helps, and also include them in joint physio sessions and learning about people's care. But I still think one of the main challenges is that full integration that needs to take place, because that is what gives people the greatest sense of preparedness in going into the community, as Susie mentioned. The other things, recent research, recent information that I think is informing us in spinal cord injury is from Susan Jaglal's work in Canada. She talks very much about a competency-based model for caregivers and looking at the kind of skills that they need in terms of decision-making and time management, self-care, which is really crucial in terms of maintaining the longevity of the relationship and the care provision. Also about talking with the person and the caregiver about their relationship, about the stresses and strains that might come from, that might develop after a spinal cord injury, about whether the person, the loved one will be the primary caregiver, or whether they do have assets that can facilitate other types of care. and a lot of negotiation around the relationship and how to straddle the dual relationship of being a spouse, a family member, and a caregiver, and the sometimes conflict that might be associated within that. So I think those are some of the challenges that that can be faced, as well as the acknowledging and screening and supporting the caregiver itself, as Susie mentioned, which I think in an ongoing outpatient review of the person with the spinal cord injury is absolutely crucial.
Thank you, Dr. Jane Duff. Both of you mentioned about the importance of healthcare professionals in helping the persons with spinal cord injury overcome their challenges. The aspect of caregiving in India by family members is unique as compared to the developed world, where caregiving is most often equivalent to formal or paid care. As per the Patna model of the caregivers are trained and involved in management during hospitalization and continue to provide care at home. In the case of family caregivers, the aspect of great emotional involvement along with the physical responsibility of caretaking adds to the burden of care. So that brings me to the next question to Dr. Shanu Srivastava. Dr. Shanu, how about healthcare professionals in India? To what extent are the challenges similar or different? How can healthcare professionals in India approach caregiving challenges? Dr. Shanu Srivastava.
Yeah. Hello. Hello. Good evening, everyone. So yes, if you are talking, and I have heard to Susn and the Jane, the situation is same as we are saying that at the hospital setup, yes, we are doing a lot of things, but yes, when they are going back to their society, when they are going back to their family, the things are different. And if we are talking about the healthcare system of India, that is quite vast of healthcare system. But as we know that 70% population of India lives in rural areas. So there are only the primary healthcare facilities are available. There are only the primary healthcare centers are available. If there is any kind of spinal cord injury had happened with any person, it's very difficult for them to take them out from that rural area to a big hospital, the multi-speciality hospital. So I think the healthcare system should reach to the rural areas, and we have to work on that. And we have to facilitate lots of things to the rural person also. And if you're talking about I think can we just see the question once again, sir?
Yeah. To what extent are the challenges similar or different? The challenges which the persons with spinal injury face, and how do healthcare professionals manage them? Is the approach by the healthcare professionals to caregiving challenges similar or different?
Challenges are similar, but yes, here the community is different, their culture is different in India. And mostly people, when they come to the Indian Spinal Injury Center, and when we talk about them, just go and meet the psychologist. So they always say that I'm not an insane person. Why the doctor is saying that we have to meet a psychologist? So lack of awareness is definitely there, and psychology and psychiatry has become a very difficult topic. And people never think that if they got the spinal cord injury, they should meet the psychologist just to reduce their stress and strain, and they just for becoming positive mind, they have to meet them. So these kind of challenges, yes, we face each and every day at our hospital. And because mostly people are coming from a rural background and they don't know and they are not aware. So it's very difficult for us sometimes just to make them aware about the importance of such kind of psychological facility. And the caregiver always go through with lots of stress, strain and anxiety. And if we are not taking care of them at on a very primary level, then it can become a very difficult for them. So, but it's a just to make them realize it is difficult task for the healthcare person in India, I will say, because sometimes they don't think about it. And because we have very strong family support in India, so initial stages, family and caregiver can go through with very easily on the initial stages. But after some times, when they got to know that this injury is going to be permanent, then there is no family support. So then lots of anxiety, stress, and depression we can see in the person who is the primary caregiver. So challenges, some challenges are same, but yes, at somewhere it's very difficult task for us.
Thank you, Dr. Shanu. You discussed about the largely predominant urban population in India, which poses a different challenge. And you also discussed about the attitude of, in general, people in India, in that where they do not take in the role of a mental health professional as easily as is taken in the West.
Definitely, definitely.
Yeah, there is also the doctrine of karma, in which people think that whatever they are going through in this life are due to their sins or their whatever they have done in the previous life, and they tend to accept things more easily. The golden rule, karma, doing unto others as you would have done to you, goes beyond principle and may in fact be backed by science. Psychologists have dubbed it the helper's high, a blissful feeling that you get after you do something for someone else that is helpful or kind. Thus, in the Indian setting, it's not only the spinal cord injured who can accept disability more easily. Most of the caregivers do not consider the caregiving process to be burdensome or stressful, as they consider it their responsibility. This is as per this publication, the ground reality. Dr. Shanu, Srivastava and others may be able to tell better. Studies have opined that interventions or support will be effective only for those caregivers who express a felt need for these interventions. On the other hand, there are studies as well which bring out that in the initial stage of illness, caregivers may not have the attitude or inclination to understand the procedure or benefits of the intervention being taught to them. So we come to Mr. Swami Nathan Venkatraman, who could let us know about the Indian scenario. What is the caregiver's perspective of how healthcare professionals can help? Mr. Swaminath. Please unmute yourself, Mr. Swaminath. You're not able to?
Yeah, now. Yeah. It's not allowing initially.
No, I can hear you loud and clear. Please go ahead.
Yeah. So I would share my experience for the past 2 years, wherein how I see is the first and foremost step. What I feel is if the injured person in the family, the care recipient, if the care recipient's issues are addressed, some of the caregivers' issues are also addressed. So the caregiver basically, he needs to make decisions on his behalf as well as the recipient's behalf in some cases. And this is not something, a normal role that the caregiver performs day in, day out. And there is this anxiety that those decisions need to be correct as well. So that is one of the things that we need to have a look into. And as you know, that being responsible for nursing procedures like catheters, skin care, and having a very limited knowledge on such conditions, because this condition is not something that you hear often and then you are not prepared for this. So for me, I see it the way healthcare providers can support the caregivers as well as the injured persons, or spinal cord injured persons. It starts from the hospital. So just after as the other speakers, panelists were talking about, once we get discharged, and then the initial days are pretty crucial. And the kind of challenges that I faced is the physical issues that could, physical changes or transformation that could happen, or the issues that the injured person could face. And even it could be a mental issue, like a breakdown of the injured person. And at that particular point of time, the caregiver is totally clueless on what is the stage at which he should seek a healthcare professional's help, and that healthcare professional should be available and easily accessible. I think in this case, maybe a guidance nurse, a 24-hour support just post-discharge on to help the caregivers, or a detailed set of instructions or manuals which could help the caregiver to take care and initially adjust to these conditions in his life or her life would greatly help. And that is something healthcare professionals can do. And in our case, my personal case is like, I was also clueless when to start the rehabilitation program. What is the right time to start? Whom to approach? And some of these healthcare providers or the hospitals, they give you hints, but nobody gets into the detail and guide you. This is what it is, and this is the way it is done for such cases. So I think somewhere there is a lack of information, lack of guidance, which could be improved, and also a teamwork when it comes to these spinal cord injuries, because these spinal cord injuries could lead to further complications, which may occur in a month's time. In our case, my wife suffered from ossification, heterotrophic ossification in the hip joints, and she had restricted movements. So many new things, and it was like each and every month you get something new, you have something new, and you don't know which one to worry about, which one not to worry about. And I think somewhere a teamwork of all the healthcare professionals of various disciplines is the key, and a continuous support just for the post-discharge period helps the caregivers as well as the care recipients. I think I always insist, in my case, I always felt one should have a general practitioner or a nurse where one could coordinate between various disciplines, where different issues or complications that arise out of the spinal cord injury could be addressed.
Thank you, Mr. Swami Nathan. You have given an insight onto how caregivers feel they could be supported for the challenges that they face. Rima, your father was in India, your mother was in India. You've been a secondary caregiver, but you have also seen the life in US where you live and where you have been living for a very long time. And you may have interacted with other caregivers also in US. Do you think there is a difference in caregivers' perspective in seeking health from psychologists and other mental health professionals between India and the other developed countries? So, Rima?
Hi. So I honestly think that anyone anywhere in the world who undergoes disability as a result of spinal cord injury or stroke has very similar challenges. What is different is the system support, or the level or extent of system support that they get, which I would say in the US is probably significantly higher on average. So in India, I would say there's a lot of variation, because you could be, in Delhi in a very good hospital, and you would be getting, the I would say, the medical care, attention, support, which was the equivalent to what you would get in a developed country. But you could also be in a smaller town where you don't have access to the best care or the best specialized care. Or you could be in a rural area where you can't even get to a primary care center or any kind of healthcare facility. So there's, I think, the issue in India is the variation also. I think the variation, or the spectrum of variation, is very, very different. In terms of so the issues are very similar. In terms of resources available, I would say there's a lot more structure here. There's a lot more systems in place here. There's access to more things like home care, which, again, every system has its challenges. So, but there is access to some level of home care. There is access to insurance coverage for some level of home care. So there's some level of financial support that you might get with your caregiving, which is also a big challenge in India. So that in terms of people, I think people are the same everywhere. I mean, there might be more acceptance of mental health support in the US than there is in India, but I think I'm not sure that was always true here either. And even here, I think there's a lot of systems effort in normalizing access to mental health. I've seen I've actually seen ads literally which say, if you had a cold or a flu, would you not see a doctor? So if you have anxiety or depression, why wouldn't you see a doctor? Things like that. So there is still, even though it's a little different, but there's still that, there's a little bit of resistance, I think, that happens. But coming back to care, caregiving, Mr. Swami Nathan did address, some of those challenges and expectations from, healthcare professionals, and a lot of the other panelists who have spoken about that too. So in my case, I would say, my father had a stroke which left him a quadriplegic, completely paralyzed neck down, unable to speak. And my mother was a primary caregiver. And as Dr. Chhabra said, she's thought of it as her responsibility, her duty. There was, there was complete acceptance. So this is what I need to do now. And my role was really of a secondary caregiver, planning, assisting, supporting, helping, helping the primary caregiver feel empowered and confident, doing research on her behalf, just helping in every which way. I would say there's a gamut of physical, mental, and emotional challenges that face a caregiver. They may vary, but every caregiver faces a lot of challenges. And there's some very simple but important things that healthcare professionals can do. And as I've been listening to the conversation, some of these have been mentioned. I would like to kind of just try and summarize these from a patient caregiver perspective. I think the first one that did come up is just communication. It's information, what's going on, transparency, participation. Dr. Duff mentioned participation in goal planning, integration of caregivers. And it's not always possible, but to the extent that's possible, it's very, 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 very important at every stage. The second one that has been mentioned is training. Again, very important training. Teaching caregivers how to take care of the patient, solve problems, but helping them feel empowered and confident and knowing where to go. The other one I would mention is having a holistic understanding of a patient situation. There's a lot, when you're in a hospital or any care facility, there's a lot of focus on the medical needs of the patient, the medical condition, but being aware of their family situation, their home situation, what their psychological situation is, and understanding their perspective, considering their opinions, discussing treatment options. For example, something like a tracheostomy may be a simple procedure, for a clinician, but it has immense implications for a patient's quality of life going forward, for the caregiver going forward. And so, just things like that. And related to that, it's may not be relevant in all situations, but in some situations, one area that I think clinicians don't often address is palliative care and thinking about optimizing quality of life of a patient. And it's a term that's often misunderstood, especially by patients and caregivers. I think healthcare professionals understand it, but I think they worry about how referring to palliative care might be perceived by patients and caregivers. And I think some clinicians, and please correct me if I'm wrong, I'm an August company here. There is a concern that, mentioning for things like palliative care is equivalent to giving up and not doing your best medically for a patient. Whereas it could actually be the best for that particular patient, assessing their particular situation and just staying focused on quality of life.
Thank you, Rima, for this wonderful insight. Moving onwards, community-based organizations play a large role in influencing the availability and quality of support available. Research across family caregivers of different populations of people with disabilities indicate that peer-led programs result in significant positive changes in terms of action and caregiver well-being. So that brings me to the next question, which I will address to Bhavana, Issar, and Luke Dolan. How can NGOs and various stakeholders other than the government, what can these NGOs and various stakeholders other than the government do to help overcome challenges faced by caregivers of persons with spinal cord injury? May I request Bhavana, Issar, to give her thoughts first?
Thank you. Thank you very much, first of all, for having me here. And I'm grateful that we are having these conversations. Caregivers and caregiving in India is rather invisible and unrecognized, much like anywhere in the world, but more so in India also because it is expected of women to do this work. And we know that unpaid care work is just large and really expected in our culture. There are stereotypes for women. Now, just like it takes a village to bring up a child, I think it somehow takes a village to look after someone who is ailing or has life-limiting conditions. So we do need a large team, and many of the previous speakers have spoken about them. While there is a primary caregiver, there are many other parts of the system that have to work together so that the caregiver can be well and the caregiver can do a good job of looking after. I would like to talk about three big parts. There is a big role in terms of advocacy, policy design that government has to play in terms of recognizing this role. Family caregivers carry a significant burden of our healthcare system. Healthcare system in India is one of the most underinvested in the world. So we have a long way to go, and therefore we need to recognize what's really working. For this, NGOs tend to be around specific medical conditions. And maybe what we need to do is find ways of collaborating so that the common thing is addressed and we don't have to reinvent the wheel. So there are some commonalities across medical conditions. That would be, to my mind, one of the things that we can do better. We also need NGOs to be well-resourced so that they can hire the best minds. Unfortunately, NGOs are not well-resourced. Finances are under, and therefore not the best minds go to work in NGOs. And governments can play a role in helping address this system. by incentivizing working there, tax breaks, etc., etc. There could be so many things that the government and NGOs can do better. I would also like to bring in the element of workplaces. I think organizations and corporates and workplaces have started speaking about diversity and inclusion. It is important for organizations to recognize that people with life limitations can be contributors in workplaces. And if we can have people with injuries, limitations, be a part of workplaces, then they will have the dignity and the financial independence, and families will not feel the pressure. I think family caregivers also feel the pressure because they feel this person is fully dependent on me, you know. So workplaces and organizations, corporates have a big role to play to be inclusive of people with life limitations as well as family caregivers with life limitations, because very often women who are caregivers fall off the workforce because they are big jobs. You just said caregiving is perhaps the hardest job. So if I have to do a full-time job and give, it can be very difficult. So I will not continue to be in a workplace, but if my workplace can be friendly, if my workplace can recognize this, if my workplace can give me some discounts, some leeway, some benefits, then I can do both the roles better and I can be a wholesome human being, a good citizen, and I could go on and on. But thank you very much for this space. I do think educational institutions also have a big role to play. We need to groom children, not just to be academics or professionals, but to recognize that caregiving is going to be a part of our lives. So it needs to be a part of our educational curriculum as well. With that, I'll take a pause.
Thank you, Bhavana. You brought out wonderfully the role that various stakeholders can play in supporting the caregivers so that they can rise up to the challenge. And this becomes all the more important in a country like India. So let's hear the UK perspective from Luke Dolan. Luke, you not only work for an NGO, but you also are a peer mentor, yourself having suffered a spinal injury in 1995, I believe, in a diving accident. So I think it would be very interesting to hear your perspective because you understand the needs of a person with spinal cord injury, a caregiver, and what various stakeholders can do to support them so that they can rise up to the challenge. So over to you, Luke.
Cheers, and thank you very much for inviting me to speak. So I broke my neck in 1995 diving into a river at C5C6. And yeah, I think when I was going through rehab, I rehabbed at Stoke Mandeville where Dr. Jane Duff is a psychologist. And yeah, when I was first injured, I think the support from my dad, who was my primary kind of care, he didn't act as a primary carer because I had care through other channels when I left Stoke Mandeville, but he definitely felt like he could have talked to somebody else who would have benefited from talking to somebody else who'd been through something similar. And with Backup, the charity I work for now, that's something that I think up until recently we hadn't really recognised. There was a big gap in supporting the people who support people who have had the injury. So the support for the caregivers and family members of people with the injury. And it's just as important to support them as they are, integral in the success of how well you get back to life post-injury, and how Backup have, as you mentioned, Chhabra, we were founded as a charity to help get people back on doing kind of things that you wouldn't necessarily expect somebody with paralysis to be doing. And then from that experience, people realize that their life isn't over and you can have a well-meaning, meaningful and active life post-injury. but we since diversified quite a lot in terms of the support we offer to the person with the injury through peer support, and realizing that matching people and using the information and kind of wealth of knowledge that people who live with the injury to support people who are going through it, in the early stages, really speeds up that process of rehab. And then through the success of providing that service for people with the injury, we've now moved to kind of offer that for family members. So we have a family mentoring program and a huge kind of bank of family volunteers who have all been trained to be mentors. And the training happens, I think at the moment we do it 2-3 times a year, and it's over a weekend. It's kind of crucial. It's not counselling. We don't train these family members of people with injuries to be counsellors, but we train them to kind of be a support network or a support for the next generation of people coming through a similar journey. And we act as a facilitator or a conduit to make those connections, make those networks, and the bigger bank of people that we have, the kind of closer we can get to matching, having a close match with something. I know everybody's injury and situation is different, and the common ground is always the spinal cord injury. We do ask to focus on the similarities and not the differences. But if we can make the relationship at least the same, so if it's a partner of somebody with an injury, we'll match it with another partner of somebody with an injury who's got 10+ years of experience. And it's an opportunity for the family member and the caregiver to ask those questions perhaps they don't feel comfortable, don't want to burden their loved one with. And it's that information exchange which can be really, really beneficial. And in the light of the pandemic, we've not been able to do the face-to-face activities and courses and support that we were doing, but we have offered similar to this, but an open forum Zoom chat, which we call the Backup Lounge, which happens every other week. And in that lounge, people register, and there are various rooms that we kind of distribute people into. One of those is the family room, the family lounge, and that's been a really, really, I think that's something that's going to live on post-pandemic, and it's really helped with the geographical limitations of meeting up face-to-face, even in a country as small as the UK. But we can kind of pull that information and give alleviate some of the stresses of the caregivers and the relatives by letting them share their stories with other people that know firsthand and have that lived experience. And yeah, I guess for us, we noticed that, and as it's been mentioned by the previous panelists, if you don't look after your support network, then they aren't in a place to look after the person they're supporting. And so it's one of the biggest challenges we've had is trying to get relatives to recognize that they have needs as well, and they've been affected by what's happened, and really trying to press home to them that it's really important that they prioritize themselves sometimes and take care of themselves, so they're in the best place to then offer support for other people. And we as best we can, we're kind of working on. We have a person, I work for the outreach and support team for people with spinal cord injury, but we have now a lady, Nicole Scott, whose her sole job is to do outreach and support for family members. So that's her role, and she's a partner of somebody with a spinal cord injury. And trying to introduce these relatives days that Dr. Jane Duff already mentioned in all the spinal centres. Those are kind of education days for relatives, which have been really successful. Trying to implement them across the whole country, getting there slowly. I hope that answered the question a little bit about what we do anyway.
That was lovely, Luke, and thanks for bringing out so well how various stakeholders can help the caregivers overcome the challenges, and especially in the situation of a pandemic, how we can tap the opportunity. And that's exactly what we are doing today with people from across the globe interacting together on this issue. So when we talk about how various NGOs can work, I would want to bring to your focus the good work that the Spinal Foundation has been doing. They have created a strong peer network, which works as a hub and spoke manner for to and fro dissemination of such information, creating a pool of trained peer mentors. A central peer mentor group has branches in states and union territories. A caregivers group has also been set up for interactions amongst them. So that's the role that NGO can play. Some of the ongoing work of the Spinal Foundation are developing content as for, say, no to bed sores, right to right wheelchair, the CAT Club, sporting activities, global engagements, research and registry, touch freedom, awareness drives working towards prevention of spinal cord injury. Family caregiving support is not included in most social policies related to people with disabilities. Bhavana Issar also talked about this. Research also shows that whatever support is there, it might be more challenging for some families to access due to information barriers and difficult processes of requesting access, and that higher earning families are more likely to use these services than low income families. So now we come to the next question. What can the government do to help overcome challenges faced by caregivers or persons with spinal cord injury? And let me start with Dr. Jane Duff first here. Dr. Jane? Yeah.
Thank you. Something crucial that I forgot to mention is that we at Stoke Mandeville, we have a family counsellor, and I think recognising that caregivers are integrated within a healthcare system, and that kind of provision actually makes a huge difference for acknowledging caregiver needs, integrating them in the system, and addressing their emotional concerns. So that's one of the things that we've decided to put our funding towards in terms of the service that we provide. However, as Luke mentioned, we're the only spinal injury centre that does this in the UK. And I do think that caregivers are generally undervalued. So one of the key things I think governments can do is recognise the health gain given to the person with spinal cord injury by the caregiver, such as keeping people out of hospital, such as the much greater costs on a health society, on the government costs of rehospitalisation that would be involved in spinal cord injury without the care provision, from somebody's family members. The other crucial thing is recognising, as I mentioned, about primary physicians screening caregiver needs and enabling caregivers then to access psychological counselling, whatever's needed to support them. So screening for there's a good questionnaire, a family strain questionnaire, which takes 5 minutes for primary physicians or primary nurses to do, or screening for depression or screening for anxiety, because the caregiver is the foundation. Unless they're strong, the person with a spinal cord injury is much less likely to be strong. So recognising that, I think, is crucial for governments and any healthcare system.
Thanks, Dr. Jane Duff. Dr. Susn Charlifue, what do you have to add to this? And do you think what potential is there for the government to do to help caregivers? Do you think in US sufficient is being done, or is there still a gap?
Sufficient is not being done. I can assure you of that. In the US, a lot of it depends on the type of insurance coverage a person has for their injury. As you know, we are not a socialized medicine country, so people have to get their own health insurance or pay for themselves, or they may qualify for one of the government programs, Medicare or Medicaid. Medicare is typically available 2 years after injury, or for people who are age 55 and older. Medicaid is for people who are financially indigent. The one system that does provide some assistance is in the Veterans Administration, which serves people, former military members. They do offer some payment to family caregivers. It's minimal, it's not a whole lot, and it's usually to cover bowel and bladder care. But out in the rest of the non-veteran world, in the civilian world, there's not a whole lot in the way of resources. It depends on the type of insurance a person has or the type of insurance coverage based on how the injury occurred. Workman's compensation, for example, is probably one of the better coverages. But even then, caregivers are not compensated fairly. The actual cost of unpaid caregiving in the country exceeds the amount that is paid out by Medicare and Medicaid in total. So we are providing, our family caregivers are providing a lot of care for free. And people would say, well, their family members are going to do it anyway. Yes, but they may have had to give up their jobs. Now, having said that, I want to quickly divert to COVID for a moment. COVID has had a very negative effect for caregiving because a lot of agencies will not come into people's homes or have not been able to come into people's homes because of COVID and the fear of transmission or getting ill. It's been beneficial in that some workplaces have allowed people to work from home. And if they're also providing caregiving, then they're right there. They can still do their job. They can still get paid and still provide necessary care to their loved ones. It's a little bit of a mixed bag, but really the government needs to recognize that unpaid caregiving is a real bargain for them, and it would help them to pay for this caregiving because then they might not be paying for hospitalizations and a variety of other things that would impact the bottom line of the government.
Thank you, Susie. Luke, what do you have to add to what Jane and Susie have mentioned about what the government can do to help caregivers? And what are your impressions? Could there be more which could be done in UK for caregivers by the government?
Yeah, I think a lot of the time when we speak to people that are struggling, it's a funding is a big problem. I think as well, I was speaking to my colleagues yesterday about this question, and they were saying that where there is provision for care through kind of government funding, and it's a bit of a postcode lottery. So it depends where you live in the country, what you'll receive, and if you can get care provided for you, and it can be enough to pay for a private carer to come in, but you will never get the same money if it's a family member doing it. Yeah, I think it's a big ask of a family member to give up work to be a primary carer and not to be recompensed for that. We also talked about respite, and that there is no respite facility. So I guess it would always be helpful that the caregiver could have some time away from giving care, but feel safe that their loved one is being looked after in that time. And just to give a bit of a break, and also to maybe, I think Jane mentioned earlier, to kind of to bring back that dynamic of the relationship you had before injury. It's nice sometimes not just to be the care provider all the time, and to have that dynamic back that you had before. Yeah, I think it's often funding, and the pandemic's made it worse. So.
Thank you, Luke. Shall we hear the Indian perspective first from Dr. Shanu Srivastava?
Thank you. So if we are talking about the Indian perspective, then definitely I will say the finances are the worst thing which faced by the caregiver, because caregiver always worry about what will happen next, and if the person who got the spinal cord injury is the breadwinner of the family, then what will happen next, and how the family will work, and how we will take care of that patient. So these kind of worries are there. So I think government should help in the finances. And the most important thing is the infrastructure, because accessibility is the big issue. Spinal cord person or any wheelchair person should not think that should I go there or not? Is that area is accessible for me or not? So this question should not come in the mind of any person who is on wheelchair. So I think the whole country should be accessible for the person. Here at hospital, we always teach lots of the wheelchair skills to the patient, and caregiver always say to us that we live in a very rural areas, there are not proper roads. So how the person can go out from the home on wheelchair? So this is the reality, definitely. So government should work on that. So everything should be accessible. And I will say that whatever the Bhavana ji has said, that government along with the NGO should work on that. And we have to just take care so many things like finances, like infrastructure, like accessibility, then it will be a good support for the caregiving, and it will be good support for the caregivers also, and we can just reduce their stress and anxiety. And the one thing more, I think with the help of NGOs, the government should make a support system which can be accessible for each and everyone. Whether the person is living in the big metro cities or whether the person is living in the rural areas. So support system should be very, very strong. Although we in India, our family is a big support system. But when the family member got to know that this injury is a permanent, then only the primary caregiver or secondary caregiver with the person who is taking care of the person. Otherwise, there will be no maternal uncle and there will be no paternal uncle. There will be no extended family members who will support. When they will get to know that this injury is going to be permanent, then they will be back out their support. So definitely the support system should be very strong, and it should be not accessible only for the person who are living in the big cities, but yes, the person who are living in the rural areas. So government should work on that. I think so. Thank you.
Thank you, Shanu, for that a wonderful insight on what the government can do in India. Actually, with communicable diseases rampant, right? They try to put all their money into where they can show effects immediately. And disabilities and spinal cord injuries and all other disabilities take a back seat. And I think we need to push for that, as was mentioned by our colleagues from abroad. If we can impress upon the government that it is cost effective, right, for them to invest, so that they do not then invest in the treatment of secondary complications which happen to these people. And if they make them economically productive members of the society, it's ultimately more cost effective. We need to impress upon the government in this regard. Bhavana, Issar, you talked about that gap in support from the government also, and that's why the NGOs and other stakeholders have a bigger role to play. What do you need? What would you want to add on to what government can do to support caregivers?
I think that like Dr. Shanu pointed out, the biggest concern given the healthcare system is not public and everybody doesn't have access to it. We need finances. The fact is that in India, 55 million people go below the poverty line because of out-of-pocket medical expenses. And women and girls do 3.26 billion hours of unpaid care work every single day. The fact is that women and girls or family caregivers contribute about $1 trillion equivalent to the GDP or the economy of our country. This is 37% of our overall economy. What we need to recognize is that if we can create an ecosystem, the government needs to support creating an ecosystem for the family caregivers, because this is the foundation of our economy. We are lacking in building, there is a whole world of livelihoods, of products, services that can be set up if only we can recognize the care economy. And for a country that might need employment, for a country that wants to drive economy, we need to just simply see this, that this is an unaddressed area and it is the very engine for family systems, for economy, for growth, for gender equity, everything.
Yeah, thanks, Bhavana. Perhaps you recognize this need so long ago that you left your very promising career and decided to help people who were in need in this regard. We appreciate your valuable contribution. There have been also comments in the chat box on if persons with spinal cord injury are well rehabilitated, well managed in the hospital, and if they are supported when they go back at home, there will be less stress on the caregivers, because otherwise they get unduly loaded, meeting the normal requirements of persons who have not become independent because of neglect on the part of healthcare providers and other stakeholders. For caregivers of adults and older adults with disabilities, organizations in USA provide extensive model caregiver support programs that provide information, evidence-based interventions, and financial assistance. So my question is now addressed to Dr. Susn Charlifue and Dr. Jane Duff in that order. What can professional societies do to help overcome challenges faced by caregivers of persons with spinal cord injury? Dr. Susn Charlifue.
I think one of the things that organizations such as ISCOS or the American Spinal Injury Association can do, first, advocacy. We need to be advocates for family caregivers. We do a great job advocating for people with spinal cord injuries and disorders, but not always for the caregivers. I think one of the other things we can do is maybe develop position statements or white papers that can be shared with government agencies. We're very good at speaking to our colleagues in the field, but we don't always go outside well enough to inform those in the government or other agencies, even family practitioners who could help out. Education, we could do a lot more in terms of providing educational materials and making them available and accessible and understandable by government agencies and government workers. And I think we need to do more research and supporting the research that demonstrates the benefit of supporting caregivers. If we can actually show in financial terms what the benefit is, that might speak more loudly to the government than if we just say, oh, it's something we really need. We need to kind of put the dollar sign on it. I certainly, that sounds very crass and I apologize for that, but the reality is our governments are all financially strapped. With COVID, they're really suffering a lot. They're having to support a lot of things that they hadn't intended to do. We need to demonstrate that there's a cost benefit to providing services and assistance to family caregivers.
Thank you, Susie. Dr. Jane Duff, you also have been involved with various professional societies. What is your perspective of how these societies can help caregivers?
I would very much underline what Susie said, because in the UK, we've quantified the cost of someone having a spinal cord injury, but not the cost of caregiving. So, and all of the above that Susie said in terms of the professional societies. There's a question in the chat around a handbook for caregivers, which I think that would be something, if ISCOS could develop that as part of the e-learn package, I think that would be very helpful. We've got a couple bits of information. We have a handbook for the person with spinal cord injury in the UK, but I think an alongside one for caregivers. I'm also going to be challenging to ISCOS and various professional societies, because although we say it's biopsychosocial, we're still predominantly physical, we're still predominantly bio. And I think full integration of psychological well-being, but linked with that, the full integration of social well-being. I think Rima said knowing about someone's support network. And that's not the first question when somebody's admitted to hospital. And it needs to be, we need to know what is important to that person with the injury and enable that integration, enable that participation. And the tech is there now. We've learned through COVID, it's much easier to communicate with family members. They don't have to be in the building. And that involvement in multidisciplinary medical ward rounds, in every aspect of the person's day, I think is a challenge to us all, but a challenge that's worth rising to.
Thank you, Dr. Jane Duff and Dr. Susn Charlifue. Both of you mentioned about how professional societies can help the caregivers overcoming the challenges that they face in caregiving of persons with spinal cord injury. Both of you are in very responsible positions in various societies, and we will look forward to your actively intervening in this regard. So both of you also talked about a handbook, and you'll be very glad to know that the consumer module of elearnsci.org, a web resource, which came out initially for all healthcare professionals involved in spinal cord injury management. But now this consumer module is ready to be launched in the forthcoming conference of the International Spinal Cord Society. And this will be a big boon and a big help to caregivers and persons with spinal cord injury across the globe, because this is a useful resource which would be available to them free of charge. And what more, it has been translated into various languages as well. Also, the International Spinal Cord Society has its consumer special interest group. The Spinal Cord Society here in India has the consumer committee. I think there is a need also for them to have a caregiver special interest group so that they can focus more on these issues per se. So the professional societies have a big role to play. A study on caregivers of Parkinson's disease, I believe the issues of caregivers remain the same, pointed out that support from sources such as the larger community, NGOs, and governmental organizations were below the midpoint, with support from governmental organizations being the least. Now, I would address this question to our caregivers, panelists. What is the caregivers' perspective of how NGOs, government, and professional societies and all stakeholders can help caregivers in rising up to the challenge? So let me ask Mr. Swami Nathan first.
Yeah. So I see from a caregiver's perspective, when such a situation occurs, the physical well-being, the mental well-being, and also the economic well-being of the family is affected. So when it comes to the government, NGOs, professional societies, what we need is a support system, and even that support system, and we expect some sort of a continuity in that support system, wherein there are different stages where a caregiver requires support, and the roles have to be smoothly transitioned from the hospital, from the healthcare provider, then to the support systems that we have in the form of NGOs, professional societies, government, on and on and on and on. I think that is what is required at this point. And as I mentioned before, I think a better living conditions or better quality of life of the spinal cord injured person would definitely reduce the stress, anxiety, and all the hardships of the primary caregiver themselves. And that is a mental aspect wherein people talked about accessibility, for example, and opportunities of the affected persons with the injury. I think these are some of the challenges which not just the spinal cord injured person goes through, the complete family goes through, along with the caregivers. And that addressing these issues in the first place will lessen the burden on the caregivers, I would say. And then we talked about the guidance to move forward after the acceptance of such a situation in one's life, because it is always a dilemma people get sucked into, wherein which one to prioritize. It is going to be the care recipient or the caregiver's own issues. I think what one would prioritize. I think that is a mental issue. I think it affects people mentally, the caregivers, as well as the recipients. And that is where good counseling or guidance would definitely help from the support system or the support groups. And that too, in case of a spinal cord injury, it doesn't stop. There is no fixed tenure as such that you leave the hospital addressing your the most important issue of the injury and then move on. It doesn't work like that. The support system has to be there for a longer period of time, because at each and every stage of acceptance and moving forward and trying to get rehabilitated, the whole family undergoes a lot of challenges, and each and every challenge needs to be addressed. So we talked about the manuals, sort of a handbook for caregivers and all that. Of course, those handbooks would definitely help it during the initial stages, but at the same time, the support or the required information based on the challenges one would face at various stages is what is very important. And that requires a program for caregivers for in such cases. And the second thing where the community can help is navigating the system. I think accessibility to the services post the injury, wherein one would, for example, one would be requiring to get a disability certificate, for that matter, to I think to at least access to the services provided by the government, or the things that one could get it done in this country. And some of these things are still held by the government with the archaic systems that we have in place. I think some of them could be taken over or taken over by the private hospitals, the NGOs who could facilitate such things and then make it accessible for people suffering from such injuries. I think, and lastly, there is a need to lobby to localize such services, because one would this would in fact improve the physical well-being of the caregiver, the mental well-being of caregiver, and if he is provided with adequate information, and if these services or the procedures or I would say the kind of things one needs to go through post the injury. One thing is to deal with the condition the patient has. The other thing is to deal with the other challenges one would have in the society. I think we need a focus on that. And for that matter, we were talking about the economic well-being, wherein is there any insurance that could be designed for people suffering from such injuries, where they could get some coverage for at least the non-injured part of the body. They could, because there are so many complications in India and the healthcare costs are not low. I think we need to lobby for such policies from the government, and that's where the NGOs, all the professional societies could really help.
Thank you, Mr. Swami Nathan. That was a wonderful overview of what can be done. Rima, can I ask you, not only from a caregiver's perspective, but also since you are a healthcare consultant, what do you think can the various stakeholders do to help caregivers? Rima, yeah. You can't, please unmute. You are not able to unmute. I'll just get that done. Meanwhile, just give me a minute.
Okay, I'm here. Sorry about that. Can everyone hear me?
Yeah, we can hear you. Please go ahead.
Okay. Yeah, I wasn't able to unmute for a couple of minutes. So I think there's been a lot of different thoughts and ideas mentioned, and both from the perspective of being a secondary caregiver / observer, as well as working with the healthcare system in the US. I think what I'd like to do is almost kind of summarize what people have said. I think from the government perspective, there's two important areas that we've talked about. One is just financial coverage / insurance. And the second one, which was mentioned by a couple of people, is infrastructure, which I think from the Indian context is very important. Just, infrastructure and physical access for people with disabilities of any sort. Now, as far as NGOs and professional societies are concerned, I think there's two broad buckets of things that can be done. There's one broad bucket which is around access, maximizing access, and the second broad bucket is around ramping up advocacy efforts of different sorts. In access, I think one of the most important ones that actually Swami Nathan mentioned recently, he used the word navigating. And navigation is very, very tricky, whether you're in the US, whether you're in India, wherever you might be, when something like this happens. There is so much going on. There are the clinicians trying to take care of the patient, and you're in a state of shock. You're trying to figure out what to do, and that continues. I mean, from that acute situation on to kind of an ongoing chronic or lifelong situation. It's what should I do? Who should I call? When should I take action? When should I call the doctor? What should I do myself? What do I need support for? And who is that support? So when I worked for a health plan a couple of years ago, every time we did surveys, the biggest issue that came up was not the individual access to individual types of resources. It was navigation. And navigating the system was kind of the biggest issue wherever one might be. So that is important, and to the extent NGOs and professional societies can help with creating those pathways or helping people on a real-time specific customized basis. I think that's big. The other, this other access is just access to clinical and non-clinical personnel for physical support, access to mental health support, counseling, peer support networks, all of which was mentioned. Training for caregivers, not just in the hospital situation, but home-based training, I think is really important. Somebody needs to go to the house and look at the house, figure out the living conditions of that person, and then try to put in place some basic infrastructure that can be preventative and supportive for the patient and hence the caregiver as well. There's information content access that was mentioned. There's access to services that provide peace of mind and help plan for long-term care, which is things like advanced care planning, legal services, healthcare proxies. There's that. So that's kind of all in the access bucket. In the advocacy bucket, I think everything that was mentioned is really key, acknowledging that unacknowledged role and highlighting the hidden cost and opportunity cost and focusing on the ROI. I think of investing in caregiver support and financial support for caregivers. So I think all of those were important points.
Thank you, Rima. In the chat box, I could also see a comment by Madhuri on the importance of trying to get insurance for persons with disabilities and also for caregivers. And that would also be a big support because very often they are deprived of this insurance per se. And I could also see the message exchange between Sarah, Luke, and Dr. Jane Duff on the importance of educational programs, the educational programs during hospitalization where the caregivers need to be trained to provide all kind of care, and also subsequently through a handbook or something. But I'm very happy to inform, and as also Dr. Jane Duff acknowledged, that the consumer module will go a big step forward in empowering caregivers and also consumers to understand, not necessarily once they go back into the community, but also during hospitalization. Dr. Jane Duff knows that e-learn part of the module, the NHS is also trying to use for training of the healthcare professionals. And so we have a lot to do in this regard. And I'm sure together with awareness, we should be carrying it forward. As evident in the literature, family caregivers are frequently underserved and lack access to culturally competent supports across the life course. Caregiving can be a taxing effort, and a support system is essential to maintain healthy, confident, and successful care providers. Interventions for caregivers demonstrate improvements in decision-making, empowerment, or perceived social support. Thus, there is a need for caregiving for the caregiver. We need to care for the caregiver. This support may be there, may be well developed in the Western and the developed countries. But as Dr. Susn Charlifue, Dr. Jane Duff and Luke said, there is a gap, there is a scope for improvement. And in countries like India, where other communicable diseases take precedence over management of persons with disabilities, this takes a backseat. But we need to work in this regard. And that's why we thought about focusing this attention on this Spine Wellness and Care Foundation webinar. This is a charitable non-governmental organization established for improving the wellness of people with spinal ailments in India. We reach and serve persons affected with spine-related ailments medically and socially to help them lead better lives. Our main objective is to provide medical, rehabilitation, vocational, recreational and social support for persons affected with spine and related ailments. And you can reach us not only through email, not only through our website, but various other social media platforms. This webinar is being held in collaboration with the Spinal Foundation. We talked about their activities before. It was set up in 2014 as a pan-India umbrella organization to partner all individuals and organizations which have been working regionally in the spinal cord injury space, inclusively or exclusively, with the motto of reaching to all persons across India and help them live well with spinal cord injury. The Spine Foundation partners with various organizations in most of its endeavors, as presently with Spine Wellness and Care Foundation. They are also available on the website and on the email and through various social media platforms. Friends, it is in our hands to create a better world for all who live in it. Come, join hands to improve spine wellness and care and to alleviate the burden of spine disease, and especially the challenges faced by caregivers, not only caregivers for persons with spinal cord injury, but also those with all disabilities. So we have run out of time. I can't see any questions in the chat box other than a few comments that we have discussed. But if there are any burning questions, we could take those questions from those who have joined us. One or two quick questions. But as they come out with questions, can I request all panelists to summarize in 1 minute each, bullet points, 5 bullet points that they would want done to help improve and to help caregivers or persons with not only spinal cord injury, but other disabilities rise up to the challenge. We'll start with Dr. Susn Charlifue first. Please unmute yourself, Susan.
Okay, thank you. 5 bullet points. First one, research. Demonstrate the cost benefit of families providing in-home care and that it's beneficial to the insurance company. Second bullet point, provide education, a good handbook that covers the basics. Third bullet point, care for the caregiver. Make sure the caregiver has as much support as possible because they need to stay healthy to care for their loved ones with spinal cord injury. Fourth bullet point, organizations need to advocate for caregivers as well as people with spinal cord injuries and disorders. And they need to do that through special interest groups, through white papers, education, however they can manage it. And fifth bullet point, I'm not a clinician, I'm a sociologist. So we just need to study our societies and see what in our society as a whole needs to be altered to benefit and support caregivers.
Thank you, Dr. Susn Charlifue. Those were words of wisdom of a very experienced person who has worked for long in the field of caregiving. Dr. Jane Duff, your pearls of wisdom, 5 bullet points.
Difficult to add to Susie. She's covered an awful lot. I feel glad I'm going second and not last.
You could repeat those points just to read.
No. I'm going. I agree with all of Susie's. I would also say recognition of parity for psychological need with physical need, recognition of social networks with psychosocial in the psychosocial model, integrating the caregiver in rehabilitation from the outset, which will facilitate the caregiver being integrated in the community, screening for caregiver need, giving caregivers permission to talk about making the transitions, making the adjustments, having difficulties coping and managing all of that so that we can give them adequate support.
Thank you, Dr. Jane Duff. Great bullet points. I think we have a lot of homework to do as we go back because there's a lot that can be done. Dr. Shanu Srivastava, your 5 bullet points.
Yes, I think infrastructure, financial support, psychosocial group, and special psychological group for the caregivers. That will be a big support for them. And I think research, yes, as Susn said, that we have to do lots of research on that.
Thank you, Dr. Shanu Srivastava. Luke Dolan.
I guess increase the focus on caregivers' well-being and think about mental health as well as the physical health of all parties and building that peer network, so promoting the value of peer support and education across the board.
Thank you, Luke. Bhavana, Issar.
So point number 1, information, authentic, accessible information and inspiration through storytelling. Point number 2, community and connection so that we feel human, valued and cared for. Point number 3, learning and transformation. So learning to be a caregiver and transforming because caregiving is a gift. So we grow, spiritually grow through caregiving. So transformation. Point number 4, healthcare systems. So an ecosystem, collaboration in healthcare systems working together. And point number 5 is valuing and integrating caregivers beyond the homes to our workplaces and other spaces.
Great points, Bhavana, Issarji. Swami Nathan, Mr. Swami Nathan, could we have your 5 bullet points, please, from the caregiver's perspective?
Yeah, I have 3, Dr. Chhabra. I think I'll be repeating some of these points, but first and foremost, education, information, awareness at all levels. Be it the patient, the caregiver, or the society, and make navigation easy. Navigating the system should be much, much better. And finally, cooperation and interaction of government, the support groups for a synergized action plan. And once that happens, I think life would be much, much easier for the caregivers as well as the recipients.
Thank you, Mr. Swami Nathan. Very crisp points. I think we need to focus our resources because we can't dilute them in order to achieve and then go step by step. So very crisp points. Rima, your 5 bullet points.
I'm going to stick with 3 as well. And again, there'll be some repetition, but the 3 that resonate the most with me, one is navigation, supporting people navigate. The second one, which I think is really important, is peer support. I think, just learning from people who have been through situations. And the third one I would say is kind of a broader education awareness, not just for caregivers, but across our communities. And when I wrote the book, I talk about the 3, what I think are the 3 pillars of caregiving, and I use the words respect, resilience, and realism. But that respect, resilience, and realism has to permeate through our society and community.
Thank you, Rima. I think you and all others have brought out a lot of interesting points that we can work on and where we don't need to be dependent on the government to move forward. I think a lot can be done by NGOs, by professional societies, by healthcare professionals. I think this would not be the end of the endeavor today. This would be the start of a new chapter where we will all collaborate. I'll be in touch with all of you and all the participants to come out with a white paper on what we can do priority-wise, bullet-wise, to help support the caregiving for caregivers so that they can rise up to the challenge. And in general, we could help in making lives for persons with spinal cord injury and those with other disabilities happy, meaningful, and worth living. So with this, I think we will bring this webinar to an end, but we will start a new endeavor, a new collaboration in this regard. Thanks to all of you for joining us for this webinar and for showing your resolve to help improve the plight of caregivers. Have a good night, good morning, good evening across the globe. Jai Hind. Thank you.
Thank you.